So let us begin with a few small remedies that we have missed from the island's keynotes. And no remedy is small because each remedy is going to help cure any all our patients whenever they are required. So although we mentioned that some remedies are rare, some remedies are small, we should actually say that they are rarely prescribed by us. And the fact is, they are rarely prescribed because we don't know when to prescribe them. If you are a good student of Materia Medica, you are going to understand when to prescribe bigger remedies, when to prescribe smaller remedies, repetition, and when to prescribe both the remedies in the same case but one after the other. That will depend on case to case. So today the remedy that we'll discuss is a very important and valuable remedy, especially in lot of troubles of female reproductive system and generalized troubles related to swellings across the body. The remedy we'll discuss is epocinum. You see that there is mentioned that the excretions are diminished, especially urine and sweat. Dropsy of serous membranes, acute inflammatory dropsy with thirst is there, and acetic acid is the another remedy that is mentioned. Water disagrees or is vomited out. Most cases uncomplicated with organic diseases after typhus, typhoid, scarlatina, cirrhosis, or abuse of quinine. So you will get many patients who are in some malignancy or some pathological disturbances and they develop edema of the feet. In those cases, we can think of epocinum as one of the top remedies to prescribe in cases where you have similar picture. There is lack of passage of urine and sweat, and the patient is still weaker, not having any energy. We keep on thinking of bigger remedies, arsenic, camphora, carbovage, veratrum album, but we tend to ignore these smaller remedies which are going to do wonderful work if you know how and when to prescribe them. Acute hydrocephalus, you will see that the remedy epocinum will work very well in such a case. With open sutures, stupor, sight of one eye lost, it is a concomitant symptom. Constant and voluntary motion of one arm and one leg. You will see that if it is left arm and left leg, the remedy is bryonia. If it is any side of the body which is affected, we can think of epocinum. And the forehead is projected. So I have had an opportunity to treat a hydrocephalus case way back in my early days of my practice. This is like 15, 17, 16 years ago. I was just starting to practice, and I saw is that the patient was not so grown up child. She was in her 1 or 1.5 year of age, and she used to have these hydrocephalus which used to kind of give out. She used to give out shriekings and all sorts of pain which used to trouble her, it seems. Epocinum was one of the remedies which I prescribed. I used to also give her belladonna, stramonium depending on the state which she was in, and she improved slightly, gradually. She survived for 5-6 years, then she passed away. So you will have to prescribe these remedies whenever the need arises. It's not that we can ignore this remedy totally. In respiratory system, you will see that the is short, dry, deep or loose, and during pregnancy if the cough is there, the remedy can be thought very strongly. Conaim is another remedy. Rumex is another remedy that you can think of very strongly. Female reproductive system, you have amenorrhea in young girls with dropsical or bloating of the abdomen, extension of abdomen to the extremities. So you will see that the young girls who are not having regular periods, it's quite irregular, they feel distended in their stomach. We can think of epocinum as one of the top remedies in such case. Metrorrhagia, continued paroxysmal flow, fluid is clotted, and there is nausea, vomiting, palpitation, pulse is quick, feeble when moved. There is vital depression, fainting when raising the head from the pillow. You can see that the remedy is very strongly and very closely present and complementary to acetic acid. APS has similar presentation but no thirst is there. Here there is a bit of thirst. Arsenic, China and digitalis are very similar to this remedy in dropsical affections. And surprisingly, a remedy which is made for the Indian cockroach, Blata orientalis, has many cases of dropsy after the failure of Apis, Epocinum and digitalis. So this is observation from one of the homeopaths who is named as Haynes. So we come to an end for today's session. We had a good number of followers so far on YouTube, and good to see someone who is enthusiastic and willing to study all the time. So that's what brings us to the end of today's session. If you have understood or got some tips from this video, do let me know in the comments below.